first speaker is Dr. Brendan Shaw. He is the principal of Shawview Consulting, which is a specialist consulting firm that consults to public, private, and NGO clients on global health and pharmaceutical policy. Shawview Consulting is currently completing a major report on Australia's vaccination policies and lessons learned from the COVID-19 pandemic. Welcome, Dr. Brendan. I would like to ask you if you could tell us about the level of vaccine resistance in Australia and what the government is doing there to overcome that. Over to you.
Great. Well, look, thank you. Thank you for the opening and the question, and thank you for the opportunity to be here. It's a great forum and I think a really important topic, actually. So thank you. So look, to start with, so Australia, actually after a slow start, about 6 months ago, Australia is one of the slowest countries in the OECD to vaccinate, but now 91% of Australians aged 16 and over now have had their second dose. So we're actually one of the highest countries in the world with vaccination rates now, which is great. But we still do have a level of vaccine hesitancy in Australia. And there's actually been some studies here in Australia. And like other countries, there are a portion of the population who are hesitant about vaccines. There's actually a University of Melbourne institute that measures this and tracks this. And so at the moment in Australia, vaccine hesitancy is about 9.6%. So that's about 9.6% of the population saying they're either not sure they want to get vaccinated or are definitely opposed to it. And that varies from state to state in Australia as well. And the good thing is that's been falling for some time. The proportion of Australians who are not willing to be vaccinated for COVID is about 6%. So there's a, if you like, a hardcore part of the population, about 6%, who don't want to be vaccinated. In Australia, those hesitancy rates have been falling with the Delta outbreaks. It tends to be that with new outbreaks that the hesitancy rate falls. And also the different states have slightly different profiles, and it tends to be the states that have had more outbreaks, the hesitancy rate is a lot lower. In terms of what the government's been doing here in Australia to help overcome that, there's been a range of things the governments have done over the last, state and federal have done over the last 12 months, 2 years. Obviously fully funding the vaccination program and making sure that's free and freely available to people and easy to access. So lots of access points. And that's been with some false starts, but that's worked. I think consistent messaging has been one of the important things here about important vaccination. It is, and not just about the facts of vaccination per se, but actually in helping people understand that it's important for protecting yourself, protecting your family, protecting your community. And also the message, I think, that vaccines are a way out of lockdown, a pathway back to normality. So the important thing, I think, is that the Australian government's had a range of initiatives, both incentives, but also carrots to get people to get vaccinated, including incentives for people to be vaccinated so they can use things like public transport, fly on planes, enter into restaurants, and people who are not vaccinated not being eligible to do those things. So I think there's been a range of incentives and carrots and sticks they've used to get the vaccination rates higher.
So my second question, which I was saying that you already started answering, is what are the key findings and lessons learned from your recent studies? So if you could also, like you already talking about findings, but if you could tell us a little bit about lessons learned. You said 6% now, and I'm very happy to hear that. I have some Australian colleagues, and when I was talking to her in May, and she was telling me there was so much vaccine hesitancy, and AstraZeneca became all complicated, and she's like, I'm somebody who would go, but there was like so much complication around vaccines. And I was surprised being in India, and I've heard about vaccine hesitancy in the US, but I was so surprised about Australia. But it's so good to know now it's only 6%, which is much lower. But if you could tell us a little bit about lessons learned.
Yeah, so I think one of the lessons coming out of that is consistency of communication from government. And I think one of the things, that example you raised, I think one of the issues that occurred early was with some of the early questions that were coming out about the AstraZeneca vaccine. I think what was important early on was to get a consistent message from government about who was eligible, and what the impacts of the vaccine were. And I think initially there was conflicting advice the government was having to deal with. And that probably fed into people's questions. So people would have questions about new vaccines. I think that's understandable. And what can help in addressing those questions or answering those questions, having clear, trusted information from the regulators and from government officials and from politicians about the importance of the vaccination, what the effects are, and who should be eligible for them. And I think one of the early issues we had in Australia was that because the advice was changing, because of the clinical evidence emerging about the vaccine, I think many people in the general public here, many of whom were ready to be vaccinated, but at the same time wanted their questions and concerns answered. I think there was a delay or a misstep there in getting that message across. And so I think what initially happened, combined with the fact that at the time there were not many outbreaks here in Australia. So Australia did a very good job initially of stopping COVID, the first waves of COVID. And so by the time, and we're also in summer or just finishing summer here at the time, so there weren't a lot of cases here. And so many people were thinking, oh, well, should I get vaccinated or not? Because there's not many cases. Australia had closed borders, so there were not many travellers coming in and out of Australia. And also the messaging coming out from the government, because the clinical evidence was changing, the advice was changing, and it was confusing to people. And I think a number of people initially, at least, thought, well, maybe I'll just wait. Maybe I'll wait until things have stabilised, we know a bit more about the vaccines. And of course, what happened then was Delta came along. And I think that changed the equation, not just for governments, but for people as well. And I think what happened was rapidly people then took up vaccination in much greater numbers. And that's one of the reasons you see those numbers, that hesitancy numbers coming down, because I think governments then got a stronger united message on vaccination. And at the same time, more and more people realised the benefits of vaccination compared with having to wait. So I think that's why you saw, and also more vaccines became available. So I think that's why you were seeing that dramatic fall in hesitancy that was there. There was some latent hesitancy and a big uptake in vaccination. Now, typically Australians support vaccination. All the polling that's been done shows that around 90%, 95% of Australians support vaccination as a concept. And there's probably about 5% who, are what we call hardcore hesitant or anti-vaccination, but even, probably only 1 or 2% are actually hardcore. So I think that's probably one of the learnings from there. And since then, of course, as I said, Australia's vaccination rates have got quite high, and we're now at the upper end of some of the countries in terms of our levels of vaccination.
Thank you so much. I think, great lessons, not just in vaccine hesitancy, I think overall pandemic management, because it's a huge country, a lot of land, people travel a lot by road, and being an island country, I know their restrictions are very strict, but it's also very good to know that how drastically the hesitation has come down, and so many people are vaccinated. On this point, could you tell us a little bit about, because I know you, Shawview works in other countries as well. So from your UK office perspective, what would you report on vaccine hesitancy in Europe? Why is the level of resistance still rising? And what do you think how it can be addressed?
Yeah, look, it's an interesting question, and to be honest, even now I still scratch my head sometimes and wonder what's going on. But I think there's a couple of points to make. So in Europe, of course, Europe has had access to high levels of vaccination, but there are parts of Europe where there's still quite high levels of vaccine hesitancy. And of course, they now are going into winter and are now dealing with the Omicron outbreak in Europe at the moment. So this has become very topical and timely to talk about. So in one of the trends is that, so for example, in the United Kingdom, there's generally about 9 in 10 people, about 96% of adults have positive sentiment towards coronavirus vaccines. There's only about 4% that have hesitancy generally. But like some of the surveys that have been done in other parts of the world, that varies depending on socioeconomic group and cultural group. So tends to be poorer, low-income parts of the United Kingdom. There's higher rates of hesitancy. And in some religious groups, there's higher rates of hesitancy than in others. People living in low-income or deprived areas of the United Kingdom, there's higher rates of hesitancy. Interestingly, one phenomena across Europe is that German-speaking parts of Europe tend to have higher rates of hesitancy. Austria, Germany, the German-speaking parts of Switzerland tend to have higher rates of Germany. It's been commented on. And there's a combination of reasons for that, I think, where there's worry about side effects, again, feelings that vaccines, are they really necessary? And again, there's an element that's not just unique to COVID vaccines, but a mix of anti-establishment, populist politics, anti-elite politics as well, which can be from both the left and the right wing of politics. So it's not just a left or right wing thing, environmental groups. And age can be a factor in that as well. So in Austria, for example, 37% of adults under the age of 35 are unvaccinated. And then the other pattern that's probably notable in Europe is Eastern Europe, in particular. Eastern European countries have quite low vaccination rates, again, in spite of having the supply there. So Poland, Hungary, Latvia, Bulgaria, Bosnia-Herzegovina, all these places have actually quite low vaccination rates. And I think there's a theory there that some of the former collapsed socialist and communist systems have instilled a deep distrust in government in parts of the community in those countries, and a lack of respect for rules and authorities providing, systems. And so that's been fertile ground, if you like, for vaccine skepticism and vaccine hesitancy. And just to give you an example, in Germany, the eastern states of Germany, former East German states, have much lower vaccination rates. Saxony has about 59%, whereas western states in Germany, which used to be part of West Germany, they're up to about 81, 82%. So there's quite a lot of factors there that are influencing vaccine hesitancy in Europe. It's quite a complex picture.
Thank you. Very, very interesting. I had no idea that the German-speaking part of these different countries shows more hesitancy. And good, you pointed out that Eastern Europe, and I had just read one news about Serbia, how initially they started offering money to people from underprivileged backgrounds to come and get vaccinated. It was criticized initially, but I think that's the government thought could be the best way, incentivize them, give them a dessert and some money if they come and get vaccinated. So very, very interesting points. Thank you so much, Dr. Brendan.